welcome back to our second of 7 Colloquium meetings in this fall series. Today is actually our first in-person meeting with a class component, but we also have our public joining in digitally from the webinar feature as well. So, good afternoon from Southeast Michigan, from the Center for Middle East and North African Studies at the University of Michigan. I'm Muzammil Hussain, Assistant Professor in the Department of Communication and Media, where I work on global media and communication and global digital politics. I'm also Associate Director of the Center for Middle East and North Africa Studies. So we have our guest expert joining in today from abroad, and I am going to do 3 important tasks that may take about 5 minutes or so. And then I'll actually let our guests do the real work of today's session. So if I may, number 1, I want to tell you and our online audience about the Center for Middle East and North African Studies. We're situated in the International Institute. The study of Middle East and North African region, cultures, and languages began at this university as far back as 1889. But the center was established in 1961 and has been committed to area studies and language training from across Middle East and North Africa since. It's one of the oldest international and regional centers at this university. Today, CMENAS is also a comprehensive national resource center designated by the US Department of Education and is dedicated to promoting a broader and deeper understanding of the region, its histories, its cultures, and its languages in all of its diversity and complexity. And we do this through promoting research, education, and public outreach programming. This colloquium, so moving to the second part of the introduction, this colloquium is a part of that education and outreach, public outreach programming. This is our second of 7 scheduled Wednesdays this fall semester, which is part of the CMENAS Fall Speakers Colloquium. Each academic semester in the fall, we select a theme by which we investigate and bring in experts globally in the area of Middle East and North Africa. The theme this semester is Public Health and Pandemics Across the MENA, a multidisciplinary exhibition. Today's our 7 sessions are organized according to 7 disciplinary and approaches to engaging with the region and its diversity and complexity. Last week, we had a historical perspective conducted by a historian. Today's focus is on an institutional approach to understanding and unpacking the region. And the following 5 that we have will cover gendered, lexical, psychological, physiological, and behavioral disciplinary approaches, methodologies, and angles by which to make sense of and understand and engage with the region. We also have 3 co-sponsors of today's event. Today's gathering and event is co-sponsored by the LSA Department of Political Science, the LSA Department of Sociology, and the LSA Health Science Scholars Program, expressing the interest in today's discussion on state institutions, societal experiences at the intersection of public health in the Middle East. So we're very thankful and grateful for these co-sponsors for today's event. So as a reminder, we have a 2-hour session organized today. These sessions are broken out in 3 parts. Our first part is our invited experts will deliver anywhere from 20 to 40 minutes of prepared remarks. Then we will break for a public question and answer period, both from those attending here in person and our public audiences. If you're attending live online, please make use of the Zoom webinar chat feature where you can put in your questions, and I will bring those questions in as I see them. And finally, after about 30 minutes of the Q&A period with everyone, including the public, we will break for a final 20 to 30 minute intimate discussion with the students enrolled in this class, and that would be those of you who are attending in person today. Today's intellectual encounter poses value not only in understanding the differential case and context which we'll be hearing about, but also we'll be considering the range of relevant generalizability or the limited transportability of experiences coming from this fragile state context. There are other cases, both in the Middle East and around the world system, that may have features that are similar to what the experiences are in Gaza. And Gaza might also be a very unique case at the same time. Other cases that we may want to think about, trying to draw lessons and applications from may include Syria, Afghanistan, Yemen, Iraq, Somalia, Libya, the Central African Republic, South Sudan, which all variably are often included in the quote unquote Middle East, or certainly the Arab world, given language and cultural overlap. But all of these cases are also variably cluster often at the bottom of safety, security, governance, and development performance in world system rankings and indicators. Today's honored guest is Dr. Somdeep Sen of Roskilde University in Denmark. He's an associate professor of international development studies. Professor Sen received his PhD in political science from the University of Copenhagen, also in Denmark, in 2015. He also holds multiple graduate degrees in social science, comparative social sciences, international relations, and European studies. Dr. Sen is also an associate member of the Center for Palestine Studies at the SOAS, or the School of Oriental and African Studies at the University of London, one of the premier peer institutions that does robust scholarship on the Middle East and North Africa region. He's a published author of multiple books and many scholarly and policy-facing articles, including his 2020 book, Decolonizing Palestine, Hamas Between the Anti-Colonial and the Post-Colonial, published by Cornell University Press. He is also co-editor of Globalizing Collateral Language, From 9/11 to Endless Wars, published in 2021 by the University of Georgia Press. His policy and public-facing work has also appeared in Foreign Policy, the magazine, the Huffington Post, Open Democracy, Jacobin, the London Review of Books, the Palestine Chronicle, and the Disorder of Things. He is also, at least according to his Twitter metadata, situated between Kolkata and Copenhagen. Today's prepared remarks by Professor Sen will build from his research on spatial politics, race and racism in international relations, liberation movements, settler colonialism, and post-colonial studies and migration in his talk entitled Public Health Under Siege, A View from the Gaza Strip. Please join me in welcoming Professor Somdeep Sen. Professor Sen, the floor is yours.
Thank you. Yeah, thank you very much for that very kind introduction. And I mentioned to Professor Hussein earlier, it's 8 o'clock here. I've taught this morning. I've had a booster shot and I spent the last week with 2 very small kids in Legoland. So I'm a bit under the weather, and if I seem a little lethargic, I'm sorry. But I'm very excited to speak to you. This looks like a fantastic colloquium series that covers such wide topics, but also some important topics that really put public health on the center stage as a sort of that gives you a primer of the political, social, economic realities of a place. So I'm very happy to speak to you here about public health under siege in the Gaza Strip. And of course, it would have been nicer to speak to you in person, but nonetheless, this will have to do for now. Well, the articles that you read, you've read a chapter of my book from 2019. Professor Hussein mentioned my book from 2020. I'm obviously someone who is interested and has some experience in researching and studying Palestine. So let me just try to pull up my. So Palestine has been a focus of my research for a long time, not least since I was a bachelor student when my first supervisor, John Collins, who I recently edited the book Globalizing Collateral Language with. He's, of course, an expert in Palestine, and he published this very important book called Global Palestine. So my BA to some extent, but my master's degree as well as my PhD was very much focused on Palestinian politics, but I was bored by John Collins' work on global Palestine. I've always tried to study Palestine as a global concern and in a global context. Now, for a long time, any study of Israel-Palestine was rooted in the specificity of the context, and which is, of course, there are specific realities of that place. Nonetheless, in the last maybe 10, 20 years, you've seen a proliferation of works on Israel-Palestine that try to embed what's happening in Israel-Palestine in a global context. And I would say that I'm inspired by that work. So what you've read is in part building on that interest, where I've been interested in the politics of the region, but also the life cycles of national movements and liberation struggles. And what are the trajectories of these liberation struggles? So specifically with looking at Palestine, where I did my doctoral work, I asked, how should I theorize the politics of an organization like Hamas? And through the case of Hamas, I tried to embed it in a much more global context of Palestine and other liberation contexts, anti-colonial struggles, and sort of really deliberate looking at the developments in Palestine, and then drawing parallels with India, Tanzania, Kenya, Kashmir, Mexico, just try to understand some much more fundamental questions about colonialism, settler colonialism, liberation, and what it means to be liberated and unliberated. Sorry. Of course, all of that comes to head with my most recent book, which the World Development article that you read on COVID-19 in Palestine builds on extensively, where I place an organization like Hamas, which is often in the news, and it was in the news earlier in the year again. And I place it within the broader context of what I theorize as a settler colonial condition, where Hamas, I argue, engages in both an armed struggle and post-colonial statecraft. And how do I theorize Hamas's armed struggle as an anti-colonial armed struggle, where I draw on theoretical work on anti-colonial violence, more specifically a Fanonian perspective, Frantz Fanon, the Martinican intellectual. And then I look at Hamas's governance as a form of post-colonial governance, where classically post-colonial states tend to be incredibly institutionally weak. They have limited resources. They have a mandate over a citizenry that don't necessarily recognize their authority. So if you think about it, most post-colonial states have arbitrary borders. So the borders that were left by the colonizer, the former colonizer, don't necessarily coincide with the way people organize themselves. So the idiosyncrasies or the weakness of Hamas's statecraft was very much akin to the weakness of post-colonial states. And of course, I end with a very, let's say, a deep question about, okay, if I'm arguing that Hamas is engaging in anti-colonial arms struggle and post-colonial statecraft, how do we understand what it means to be liberated, right? Usually anti-colonial and post-colonial should be on either side of the moment when a group of people declare themselves to be liberated, right? So how does that affect how we understand what it means to be liberated, right? And I end the book by arguing that liberation is not contingent on the presence or the absence of who we consider to be our colonizer, but it's a much more internal and long-winded struggle that is bound to continue long after the official end of the colony. So there was on one side, there was this interest in Palestine and Palestinian politics that drives a lot of my research. But on the other hand, as the pandemic became a reality in our life, I also started reading up a lot about the history of pandemics and the politics of pandemics, and what is a pandemic in terms of the political realities that surround it, right? And something that really caught my attention was this quote by David Remnick, who's also the editor of the New Yorker, and he wrote this article as reflecting on the seriousness of the pandemic in New York and how it affected New York City. And he had argued that life now depends on our withdrawal from life. Fairly grim, but it's also wrapped in this narrative of a crisis. In a crisis, we say, when we define something as a crisis, we argue that everything must change, right? Whatever we have done thus far is not relevant anymore, and we need to chart a new path, right? And so life now depends on our withdrawal from life. Pretty dramatic, right? But then as I started looking at how the pandemic was affecting communities and populations around the world, what I also started noticing is that we rarely recognize that despite the narrative of a crisis, a lot, and which argues by definition that everything must change, a lot of it remains the same. And in a different piece, I argued that the larger scheme of power and privilege that were in existence before the pandemic continue to determine how the pandemic is experienced, and for whom the pandemic is indeed a crisis. A good example is the place I'm from, India, originally, which, as Professor Sen will tell you, is no stranger to pandemics. The first cholera pandemic began in the subcontinent in 1817. By 1930, the third major outbreak of bubonic plague had killed 12 million Indians. And while in sort of the collective cultural memory of the West, the Spanish flu features quite prominently, it claimed most of its victims, in fact, in India, where 18.5 million people lost their lives. So on the one hand, that the pandemic had, for lack of a better way of saying it, at 8 p.m., had a field day in a place like India. I also started noticing, who was the pandemic really affecting? And if you remember, some of you may remember, in 2020, when India finally, or end of spring 2020, when India finally had its lockdown, it was celebrated as the strictest lockdown in the world. Another story was happening on the sidelines, was informal migrant workers who were basically stuck in big cities, places like Bombay. The lockdown was announced with 4 hours notice, and these people realized that, well, if I don't have an earning in the big city, why am I living in the big city? Might as well go back home. Oh, wait a minute, within 4 hours, all the buses and the trains shut down, which meant that you had informal migrant workers walking 10, 20, 30, 40 kilometers home. And it was interesting because these people, and this was contrasted with celebrities engaging in campaigns. Bombay is the place for Bollywood. Celebrities having videos on their social media asking people to stay home. And of course, you had this huge group of I might be misquoting the number here, but 1 million people who were vulnerable, for whom lockdown was a privilege. I mean, they didn't have the privilege of being home, and they decided to go home. So it was interesting because informal migrant workers were already the most vulnerable people in Bombay or in India. And what the pandemic did was only, highlight that fact even more. So going back to my earlier point, the larger schemes of power and privilege that were there were only heightened, remained the same for all of its purposes in the pandemic era. I would argue, and of course, y'all are in the US, so you have a better sense of this. The pandemic has affected communities of color in a much more serious way, than non-Hispanic white communities. And the CDC, for instance, this was noted at some point that hospitalization rates for African Americans, Native Americans, was 5 times higher than Latino communities, than Hispanic white communities, and Latino communities are 4 times higher. This is interesting because if you look at the number from 100 years ago from the Spanish flu, it's the same communities that are worse hit. So it's interesting for me that y'all talked about history and historical perspectives last session, because it's sort of the intertwined history, intertwinedness of the past and the present is what I noticed in the pandemic. And as I moved on to write about the pandemic in the Gaza Strip, I argued that, or I articulated somewhere that the outbreak of the pandemic has shown that what makes the pandemic of relevance is the vast inequality in the way in which it impacts communities around the world. And of course, these inequalities are, once again, an outgrowth of political realities that were in place long before the onset of the pandemic, and now determine how the pandemic is experienced and for whom it's indeed a crisis. So Gaza is one such place facing the pandemic. When I wrote the article at that time, I wrote of an impending crisis, which has continued into, and at that time in 2020, it was the early stages of the crisis of the pandemic. The pandemic reached its peak with more than 1,000 people being infected every day in March, April this year. And what I show, or what I argue, is that the crisis of the pandemic here, once again, the pandemic in Gaza has the longer story that is deeply intertwined with a distant past of Gaza's positionality in the politics of Israel-Palestine, but also a much more recent political development, or relatively recent, from 2007 with the siege of Gaza imposed by, of course, Israel, as well as Egypt, And public health through the lens of the pandemic has once again become a way of discussing and understanding the political, social, and economic realities of people in Gaza. When I initially started doing my research, and of course I couldn't travel out of the country, let alone go to Gaza, which is under siege, and travel in and out of Gaza is highly controlled and very difficult. At a later point with the students, we could discuss. I did field work in Gaza back in 2013, and we'll talk about the practicalities of a field work and research endeavor like this. Nonetheless, I decided to reach out to members of the Palestinian Ministry of Health and doctors. One of them, this is in May 2020, said to me, at the moment, we have everything under control. Incoming travelers are being quarantined. We're getting a lot of help from the International Committee of the Red Cross, and we're taking all the needed precautions. But he added, if it gets worse, we will be helped because of our situation. We cannot stop the spread of the disease if there is a major outbreak. Like I said, in March, April this year, there was already a steep increase in the number of infections. But this doctor, this high-ranking member of the Palestinian Ministry of Health, when he's talking about a situation, there is a longer history then, of course, not once again tapping back to the discussion last time about history and the role of history in how we understand public health crises. In part, Gaza's vulnerability is rooted in its historical, as I said before, the historical positionality in the wider nexus of the politics of Israel-Palestine. By that, I mean that with the violent establishment of the state of Israel, there was the expulsion of 750,000 Palestinians, or as Palestinians call it, the Nakba, the catastrophe. And while the loss of a historical homeland left an indelible mark on the Palestinian national community in general, Gaza was acutely impacted by it. As with the exodus of Palestinians, Gaza also demographically felt the impact of it because it became host to 250,000 Palestinian refugees. So from one day to another, really, but through in 1948 with the Nakba, refugees became a demographic majority in this sliver of a coastal enclave. And of course, they faced dire economic conditions until 1967, so between 1948 and 1967, it was under Egyptian military rule, where there was very little done in terms of economic development, economic vibrancy, capital, infrastructural development, which meant that compared to the West Bank and East Jerusalem, which was under Jordanian control, there the political elite, political activists, Palestinian political activists, many of them were incorporated into the political system there. That didn't happen. After the war, the Six-Day War of 1967, Israel assumed direct control of the Gaza Strip. And there was some economic activity now, because now the territory of Gaza was being under Israeli control meant that Gazans could also work in Israel. But this didn't necessarily lead to any long-term economic development, because this money that was being earned wasn't reinvested into building the infrastructure or an internal economic base. Most of it was So none of that long-term development was really invested in. And what it resulted in was a steady deterioration of the internal economic base that Sarah Roy, who's an expert on Palestine, a political economist and a senior researcher at Harvard, she calls it de-development. And this process of de-development continued on through the 90s. And in the 1990s, when the Oslo Accords was signed as the first agreement between the State of Israel and the Palestinian Liberation Organization, and was seen as this watershed moment. And what was promised officially was the establishment of the institutional foundation, the institutional precursor to the Palestinian state in the form of the Palestinian Authority, which has, as you may have read in the book chapter that you read, has all the engages in all the institutional rituals of statecraft. You know, there are all the ministries are there. There are ministers, and there's a basic law. There's an economic policy. Of course, as things happen, with very little willingness, especially after the arrival of Benjamin Netanyahu at the time to power in Israel as the prime minister, there was very little, he wasn't, of course, too keen on seeing a Palestinian state. And there was very little sovereignty that was provided to the Palestinian state or to this to the Palestinian Authority. The settlement movement continued or sort of increased in pace, meaning that the occupied West Bank, for instance, was cut up into small enclaves, which are very difficult to, that also allowed the Israeli military to have a strong presence in the occupied West Bank, and of course, at that time in Gaza as well, and also meant that this pre-state, while engaging all the rituals, did not have the institutional power, sovereignty, or the resources to really act like a state and provide the goods and services that a state is meant to provide. So Gaza, being at the intersection of this past and present of the Palestinian struggle, which is why Edward Said once called it the essential core of the Palestinian national movement, Palestinian liberation movement. And it's not least because of its tendency to give rise to its fathers, it being home to or having been the training ground for many revolutionary Palestinian figures. And of course, now being under the siege, once again, it's become this sort of essential core because Gaza's, now it's become the center of a public health crisis in Palestine. And of course, that is, of course, besides the history of it, is a more recent history with the 2006 Palestinian Legislative Council elections, when Hamas, the Islamist faction Hamas, emerged as victorious, ending the domination of the secular nationalist Fatah, who has been dominated and sometimes in very authoritarian ways the Palestinian political landscape. And you can see that with the crackdown of protests in the West Bank this year. With Hamas winning the Palestinian Legislative Council elections in 2006, there was an immediate outbreak of hostilities between Fatah, which was not, of course, willing to let go of its control of the Palestinian political landscape. And as David Rose's article in the Rolling Stone magazine revealed, there was also an impending Fatah-led coup, where there was interactions with U.S. government officials under the Bush administration at the time, encouraging and committing support to Fatah if it would commit to a coup and take over military control. As it turns out, Hamas took full military control of the Gaza Strip, and since then, in June 2007, and since there has been a siege, a brutal siege by land, water, and air. This blockade has severely limited the movement of goods and capital, and of course, it has also brought the economy to an absolute standstill because capital and people can't move. So Gaza records massive levels of unemployment that go over 50%. Moreover, with every Israeli military campaign, the loss of life, coupled with the loss of destruction of essential infrastructure, has left Gazans severely traumatized, but also from a public health perspective, makes for the ideal institutional and socioeconomic scenario where a pandemic can indeed have its day, so to speak. To give you a primer, for instance, into the anatomy of a public, I'm just going to check the time, into the anatomy of a public health crisis. Of course, the World Health Organization at the onset of the pandemic said that provisions for safe water, sanitation, hygiene, waste management are all essential for limiting an outbreak. And those are sort of the essential markers or the essential things that Gaza and the authority in Gaza has trouble providing, essentially because the blockade has had a devastating impact on public health, the infrastructure, healthcare sector, waste management, and so on and so forth. So Gaza's water infrastructure, for instance, is entirely unable to meet the needs of a population under siege. And as I write in the article, only 16% of the material that is needed to construct a vital water infrastructure is available to Palestinians in the enclave. As of now, only 4% of the fresh water is drinkable, and the lack of clean water has led to, in part, yearly increase 13 to 14% in kidney-related diseases among Gazans. The lack of funding for infrastructural development, as well as post-war reconstruction, has also led to a sanitation and a hygiene crisis. There is limited finances for water treatment, waste treatment, along with chronic energy shortages. Some of you may know that when I was there in Gaza, there were 8-9 hours of straight power outages. Those numbers have only increased, and so the inability to to have a water treatment plant or sewage treatment plants means that 108,000 cubic meter of untreated sewage flows directly into the Mediterranean. Most of the wastewater has now infiltrated the aquifers, making it unfit for human use. And of course, this has led Gazans to be particularly vulnerable to the spread of diseases as well as waterborne pathogens and so on and so forth. Gaza's healthcare infrastructure is, of course, ill-equipped as well, thanks to the siege. While there is regularly a shortage of around $30 million for essential drugs and supplies, medical items, disposable items, spare parts for machinery. Of course, then again, the energy shortages only compound, only add to the healthcare sector's inability to provide the services to the population. while the numbers are relatively better today, and I get these messages from the Ministry of Health in Gaza every day, and as of now, a lot of 450,000 people have been vaccinated. But of course, at the start of the pandemic, there were maybe 40 ventilators, less than 100 available beds. Of course, that compounded with the lack of resources of the governing authority there, creates also a particular psychological effect on healthcare workers, which of course we've heard a lot about the psychological impact that working during a pandemic has had on healthcare workers around the world. But one of the quotes from medical staff that I interviewed said, "We have medical staff who are working on half the salary because the Palestinian government cannot pay. We don't have enough beds, medicines, or ventilators to fight this pandemic. We live in a high population density place where disease can spread, and we have a very poor population that cannot pay for healthcare. Because of all these things, all these problems, I'm scared every day to come to work. We're already weak, and COVID-19 has made the situation even worse." Which is a grim quote, but once again, if we circle back, it once again shows the ways in which public health is or has become a scope for better understanding the political and social realities and economic realities of a place. There's a multitude of stories or stories that we could jump into. There's been the limited access to vaccines vis-a-vis Israel, the harsh detention conditions of Palestinian prisoners in Israeli prisons that have continued despite the pandemic, and what such closed spaces can, what such environments can do with regards to the spread of the disease. So I, of course, end with a provocative discussion of the possibility of addressing the effects of a political crisis without in fact addressing the political crisis, so to speak. So Mona Jabril, who has a PhD from Cambridge, writes about depoliticizing health. And it's not an apolitical approach, but it's a depoliticized approach. But you take a humane approach to attacking a public health crisis without being limited by the political reality, right? So one could argue that in some ways, the donor policy and development policy and the policy of stakeholders with regards to Gaza is, almost entirely determined by the ebbs and flows of the politics of Israel-Palestine. This is not, of course, an unimportant factor, and Gaza has been severely impacted by the Israeli siege, by the occupation and the ongoing siege, which has been over and has led to the further impoverishment of the enclave. But because of the stigma that is associated with engaging with the Gaza Strip, has meant that the policy towards Gaza Strip is entirely sort of in this sort of vacuum, where we address all the other issues. The European Union is engaging with state building. That's once again going back to the book chapter you read, engaging with state building process. This despite such processes being inhibited by the. Sorry.
I'm sorry to interrupt. We have 5 minutes left.
Okay. Despite being inhibited by the Israeli occupation and the siege. So they engage in the sort of almost ritualistic process of institutional response and institutional reform and state building practices, even though we know that the state doesn't really exist and being under occupation, the whatever governing institutions that are there don't really have the sovereignty of it. So in the Gaza Strip, in the article, and we can talk a little bit more about it, I wonder if there is a potential, because the pandemic, of course, how the pandemic happened is affected, the trajectory of the pandemic is affected by the siege and the occupation. But nonetheless, the pandemic is unique in the sense it did not arrive as an outgrowth of the politics of Israel-Palestine. And I wonder in the article if this is an opportunity of the international community of entering Gaza, ending the siege in some way, or entirely ending the siege, in order to address a public health crisis that we're seeing now, but in doing so, also remedying some of the detrimental effects that the siege has had on political, economic, social life in the Gaza Strip. So, thank you.
Thank you very much, Professor Sen, very much for sharing your prepared remarks. We're going to move now to the public Q&A portion, building from the prepared remarks we've heard. Both students from the course that are here in person, as well as our attendees live, especially if you're attending live and would like to pose questions, please do use the Zoom Q&A button at the bottom, typically on the bottom of your screen. I see we have one question already, so I look forward to drawing from that tool as well as here. Professor Sen, as a way to get us started, thank you so much for reflecting, building from your body of work, especially from your book, where as I read it, you think deeply about, fundamentally the question, not just what is a state, which many disciplines are asking these days in the post-digital, hyper-globalized period, but the pandemic has also put an accent on that line of questioning. Very much as you started, what does it mean when we are all, life now means removing oneself from life? So things have really swung in diametrically opposite directions. So I found your work personally a very interesting beginning because you think deeply not just about this broad question many fields are interested in, what is a state, which behooves us to think about what are state institutions, on what promise do we legitimize state institutions, but you also help think in the case of Gaza, how did this state come to be? What are the rhetorics of a state? What is the theatrical performance of the state? And why and what precludes those activities? This is Gaza is a viscerally real conundrum for those who live in it or have people there. It is a viscerally real politics for those who live on the other side of the border, who are embroiled in their own commitments and politics. Academically, it's also a vexing question, thinking about the case as you intellectually also engage with, what does this analysis of this state tell us about the broader issue of state institutions? So thank you very much for helping us think about not just the case at hand, but the deeper conceptual questions of what are the state institutions there, on what promises are they delivering, not able to deliver, what are the conditions in which that can and cannot be done. And so turning to our first question that I see in the Q&A, Shinyuri Neal from the Global Public Health staff at the University of Michigan asks, how much of what you've described in your case analysis, how much of what you've described is just an outcome of racist neglect, and how much of it is intentional genocide? So it's a simply stated question. It's a pointed question. Feel free to engage with it as you understand it. So the question is, How much of this is just racist neglect, and how much is intentional genocide?
So thank you for that question, Dr. Neil. I think it's a bit of it's interesting to talk about a crisis, because I have argued in my book that it is quite intentional, in the sense that you see the crisis in Gaza. It's just not just a series of events that have led to Gaza being the way it is. And what I was trying to say with my presentation about the history of Gaza, now, Gaza has been, and I've argued this in my book, that Gaza has been historically indomitable in its anti-colonial struggle and in its military struggle against Israel. So, which is why Edward Said called it the essential core of the Palestinian struggle, because it has a tendency to start popular uprising. It has a tendency to give rise to that revolutionary figures, not least because Gaza has that particular history of feeling the socioeconomic and demographic brunt of the violent establishment of the state of Israel. So the siege of Gaza that you're seeing, or the way Gaza has been dealt with historically and even in the present, is not surprising because of what kind of political reality and what kind of opposition it represents to the state of Israel. And this is an interesting, because several Israeli politicians and military leaders have talked about wanting Gaza to just disappear into the water or sink into the sea. There's a reason for that, because Gaza has been so indomitable in its struggle, right? And it's interesting that you bring up this point about the intentionality here, because when we saw the protests in Jerusalem, and I wrote about this in an article that I recently wrote, or earlier in the year, I wrote for the Washington Post, where I talk about how when there were protests in Jerusalem over the expulsion of Palestinians Palestinian families from their homes, and this protest was gaining ground, the narrative, the official government narrative in Israel, if you follow the speeches that were given by the prime minister, they kept talking about Gaza and Hamas. It was very interesting, because those activists in Jerusalem had nothing to do with Gaza and Hamas, that was miles away. Yet it was interesting that it kept being brought up, because that is often the boogeyman Israel uses, right? And eventually, of course, as things were happening, as things were developing in Jerusalem, Israel knew that Palestinian factions in Gaza had to respond because of their historical role as the sort of bastion of the Palestinian revolutionary struggle. So this siege, the intentional neglect that you see, this public health crisis, is of course all man-made, right? The siege is actually implemented by two governments, the state of Israel and Egypt, by land and the control of movement of goods, and it's done specifically as a political act, as a military act against the anti-colonial fervor that you see among Palestinian activists in Gaza. And we can of course always go back to Hamas and what it does, but even in 2018, you had a popular uprising, the March of Return, where Palestinian activists this was a civil movement where they were just physically not being affiliated with any political faction, arriving at the border with Israel, demanding to go back as refugees, demanding to go back to their home in what is Israel today. So yeah, this is an intentional act towards a place that has a particular history as a place of revolutionary movements in Palestine.
Thank you. Any questions from the floor? We have another question from our online attendees. Ernie King asks, To what degree has Israel helped Gaza respond to the civic crisis? Or perhaps Ernie means civic crisis or maybe COVID crisis.
Okay. There has been a lot of talk about the lack of Israeli assistance towards the occupied Palestinian territories, which of course includes the Gaza Strip. There has been limitations with regards to access to vaccines. And earlier in the year, there was, or for the last year, for instance, there have been long discussions about what they were calling the vaccine apartheid, where Israel being a highly vaccinated society, yet vaccines were not available to Palestinian communities that were under the military control of the Israeli government. So there has been limited help, if any, to Gaza with regards to, and of course it didn't help with the more recent military campaign, which destroyed essential infrastructure in an already depleted place.
Question back there?
Hi, my name's Catherine. Thanks so much. I don't know if
Can you hear Catherine speak?
Yeah.
Okay, maybe you
There's
can
a
repeat
microphone right above you,
after.
so just speak
Okay.
louder.
So I'm wondering, to some extent, it does seem like your proposal at the end of your article has come to fruition in terms of entities like the World Bank and other state donors, like members of the EU and the US, have given grants and framed that aid in terms of development and economic opportunity, etc. And so I'm wondering, particularly if you look at like the World Bank grant or, the US administration's aid last year, the framing of the grants is kind of all around like the Hamas and Gaza's failure of infrastructure and placing the blame kind of squarely on governance in Gaza. And so I'm wondering how you weigh the immediate aid that obviously is so necessary for so many people in Gaza, but with sort of maybe, do you see the longer term effects or even short term effects politically of kind of having continuing framing of the blame on Gazan governance rather than the Israeli settler colonial project?
Yeah.
Okay, that was long.
I think that, the answer is in your question, right? Yes, these short-term benefits have been provided and there's some aid and there's some opening. But what we are looking at is a settler colonial project, which the siege is an extension of. So without the free movement of people, goods, infrastructural goods, services, you're not really going to see any long-term relief in the Gaza Strip, which is, infrastructurally, sociopolitically, economically devastated. It's a place where, from my fieldwork, for instance, which is quite a few years ago now, but I remember sitting with a group of young Palestinians, young Gazans, and talking about, what do they do? So it was easy being a person, who looked like this, to navigate through the Gaza Strip because you don't stick out, and people don't notice that you're not really from here. So we would spend a lot of time on the beach talking about life, and I started noticing that young Palestinian men and women, they would say that, well, I go to university, but then I also volunteer here, do this, do that, and they'll just list 6 or 7 things. And at some point, I was like, that's crazy. Why do you do so many things? And they said, well, it's because, the closure is so suffocating and it has such a psychological impact on us that if we just did one thing and we had all this time open to think about how we can't go anywhere, we don't have prospects. We are young, we're educated, it's a highly educated population, by the way. We speak English, we can't go anywhere. It has a huge, we get depressed. So we constantly work to keep our minds off of it. So without, addressing what, was it Catherine? Is that what's your name? Yeah. But Catherine, without mentioning settler colonialism, without ending the siege, this is just sort of a stopgap PR purpose. And of course, the narrative matters because you're still talking about Hamas. You're still talking as if Hamas has existed since 1988. The political realities extend long before that. So I think that without ending the siege, without a real narrative and discursive shift in terms of how we're talking about the politics of Israel-Palestine, I don't see a long-term solution in any way. Yeah, I don't know what to say. I mean, of course, I'll say I think I'm quite a bit older than you. And when I did my bachelor's, it was back in 2003 in upstate New York. And at that time, as someone interested in Israel-Palestine, you couldn't utter the word settler colonialism in a classroom. So the very fact that you're talking, you're using the kind of terminology that you are, it's, we're hoping these are better days coming.
Thank you.
I suppose I'll ask a question. Professor Sen, in communication and media studies, especially in global media studies, I'm not situated primarily on Israel and Palestine, but from what my colleagues do and what some of our students work on, there seems to be, in the way that you described from 15, 20 years ago, looking at today, a shift in the academic focus, certainly in communication and media studies. There seems to be, I think, a growing recognition that a focus on state representation and activities of the state, things like official, peace talks, are drawing less attention, and more attention seems to be turned towards popular representation. So there's been more recent work, there's active work going on the topics of cinema representations, where Israelis and Palestinians interact, where issues of power and privilege and agency or lack thereof are discussed very deliberatively in such a way where a person focused on Habermasian ideals might draw a lot of value from looking at that more closely. So the question here is, in your positionality in international development studies, and perhaps if this is an accurate assumption in maybe critical international relations work, has there been a similar shift where there's less attention towards state craft, state effort, and more towards societal innovation, societal creativity, or societal desperation leading to new modalities where there's more interesting phenomenon happening there? I'm not sure if that's a question that has been articulated clearly enough, but I wonder if you have a response or thoughts.
I mean, absolutely. And it's interesting that you talk about these cinematic representations of Israelis and Palestinians. And just today, I was teaching a session to about 30 students, master's level students, about Edward Said and Orientalism. And we were talking about the media representations of Palestinians, of Arabs, of people of color. And I was completely surprised. And I was, maybe it's because I'm so tired, I was almost touched that, these blue-eyed, blonde Scandinavians just got it, right? And I think that there is a shift. You see a shift in, the generation of students that we are seeing that are coming through the ranks, who are demanding more representation, not just in the kind of scholarly work that they read, but also critical of the white male perspective, whether it be in the media or in academia. I think a lot of it has to, of course, I don't want to take away the work that, or take anything away from the work that scholars, in international development studies, but of course, I'm a political scientist, so in international relations have been doing over the last 10, 20 years, which has all come to head with, the Black Lives Matter movement, with the decolonizing the university, with the tearing down of statues, right? Where a lot of these questions about representation, about silenced voices, about majority perspectives, about racism, have really provided an opening for academic work in and also civil society work in that deal with these issues in an open way. I'm writing articles in mainstream political science and international relations journal, articles that look at the history of race and racism in international relations, or colonial legacies of contemporary counterinsurgency campaigns. I mean, this was unheard of only a few decades ago. So yeah, I think the discussion in sort of that has moved away from state representation, the statist perspective on what is politics and what is not politics, and what is legitimate politics and what isn't legitimate politics, has been a real boon for a lot of creative work in various different fields.
Any questions? We still have about 10 minutes. Sana.
Oh,
Sana, go ahead.
similar to Saddam. Zaruk is Saddam. So you talked about, sorry, can you hear me by the way? Okay. You talked about your experience within Gaza, and I was just wondering, how was that, how are you able to enter Gaza, considering the siege and, people being able to move in and out within Palestine, especially within Gaza, is pretty difficult. So how are you able to manage that?
Yeah. Yeah, I just realized I was leaning in to hear you, but I have wireless headphones, so there's something wrong here. But well, to enter Gaza, which is the sad part. So of course, Palestinians have very limited access of entering and leaving. As a foreigner, as a foreign citizen, you are able to enter Gaza if you get permission from either the Egyptians or the Israelis. So I didn't want to go through, if you go through Israel, you'll have to ask your embassy, whichever country citizen you are, you have to have your embassy reach out to the Israeli military authorities to give you a permit, and then they give you, they give you a permit and you can enter. With regards to Egypt, you have to go through the Egyptian authorities in whichever country you are, ask the embassy, and basically have an invitation from a recognized individual in Gaza. In my case, it was Pal Think. There was this well-known sort of, they call themselves a think and do tank. It's run by Omar Shaban, who is a public intellectual. And so once you have that letter, you go to the Egyptians, and the Egyptians determine whether you are able to enter. Then they give you this photocopied letter from the Ministry of Foreign Affairs in Cairo that, my Palestinian friends told me, it sort of wishes Gazans all the best. But then it's given to you, they give you a 3-day window to enter the Gaza Strip. This 3-day window includes the day that they give you the permit. You will basically have to leave the day after if you can't leave the very day, and then you have 1 day to enter. So in that window, you have to enter. And once, and so basically it means that you have to get to Cairo, take a 6-hour car ride through Sinai to the Rafah, and then, hope that the Egyptian authorities let you, the military authorities, basically. You should, of course, know that they, on a whim, tend to close the border, so you're stranded there if you're unlucky. And then the Egyptian authorities determine whether you can enter Gaza or not.
Thank you.
I've got a couple of questions I wrote down. These are these were supposed to be more framing questions for the discussion, which I neglected, so I might as well have you engage with them now. So one of the questions that I thought that I believe you help us engage with in your approach and your methods and your disciplinary commitments is there's two parts of this question, so maybe we'll do it one part and then the next, so you have an opportunity to think and reflect and respond. So part one, how do public health challenges and acutely global pandemics such as COVID-19 unfold in context of statelessness, institutional fragility, and political violence? Now, I suppose a potential answer to that is everything you spoke about in the case of Gaza, but are there attributes or summative points or categorical answers that you could summarize, one, two, or a few, that could be used in a comparative sense? So if we learn something in the Gazan experience, can we stretch and reduce that to help understand how pandemics such as COVID-19 are unfolding in related or relatable contexts of statelessness, institutional fragility, and political violence?
Yeah, I mean, it's sort of, I don't want to repeat, repetitive, but it sort of feeds back to my earlier point about, for whom, what is a pandemic and for whom is it really a crisis, right? As we were talking to Professor Hussain earlier, and I was saying how it was really strange to see, it's really strange for me to see all of you in masks. We gave up masks 2-3 months ago, and the pandemic hasn't been, it had its moment here, but it wasn't as serious as we saw it in the US. And and being a welfare state, we have a robust healthcare system, but also a welfare state that protects your income and protects you in sort of cases of unemployment. So we have security net that protects us. So we were able to, in some way, isolate the way we're meant to. A lot of people around the world didn't have that privilege, right? Not a lot of people in the US didn't have that privilege. A lot of people in India didn't have that privilege. I come from India, originally from Calcutta, and my parents survived the pandemic. They're in Denmark now. And I remember my mom just sitting in one of these days, and I was telling Professor Hussain, as good South Asian parents, they'd like to keep their worries at home, away from their kid who's living abroad. But nonetheless, when she was here, when we were sitting down and talking, and in the evening after the kids went to bed, and she started talking about the pandemic and how they experienced it. And she was shaking, and she was rubbing her hand, and she was saying, "I don't know. We didn't know if we were going to survive, and all our friends were, dying or sick, and people were on ventilators, and the one time we went out was on Sunday, and that was the big fight between me and your dad, because my mom can't carry too much and my dad has lung issues. So who would go shopping on Sunday? Was the big crisis, right? And those kinds of conversations we did not have in Denmark, right? So a pandemic, I mean, of course, a pandemic by definition is meant to affect everything and everyone, but clearly it doesn't affect everyone and everything in the same way. And I think that this experience and the public health crisis that we've seen should give us an opportunity to rethink public health and what kind of scope it provides into understanding not just socio-political economic realities, but inequality, and how the world is experienced is vastly different ways by vastly different people. And the pandemic is just just highlighted that even more in a more drastic way. But it is the everyday reality. Inequality is the everyday reality of our lives.
Thank you very much. So, I want to build from that to the second part of this. So I think the perspective you speak from also raises the underlying structural bias in knowledge production. So, in psychology, in communication, in a lot of the social sciences, now there's a growing recognition of the bias towards what the acronym is weird context. So WEIRD. Western educated, industrialized, rich, or democratic state and society context. Now on the and why that is, I think, clearly relevant is much of the journalistic discussion, the public crisis certainly covered here in the United States and most of the world, even from a WHO perspective, a World Health Organization perspective, is situated on the challenges that advanced, industrialized, well-endowed, economically speaking states are still struggling. And thereby, there's a whole range of complexity and diversity of challenges that are not being reflected. And in an interconnected global system, there's also self-interest in that failure, right? So if we fail to understand how the world is connected and what other experiences are like, we fail to understand what we might be facing wherever our positionality might be. So this follow-up question, or the extension of the question I have for you, Som, is how may pandemics in turn affect or confound with existing institutional arrangements and political performances in fragile state environments? So it's a broadly stated question, but you can specify it towards Gaza. So the question is something like, how has this pandemic affected the activities of the Palestinian Authority in Gaza? And how, based on your prior work on sort of what that state performs and or actually does and follows through in its capacity, has the pandemic changed their priorities? Has it affected their capacities? Has it impacted the state? Because much of what you've, I think, shared, not that it's only that, but I think broadly it applies to the society and the people on the ground at differential levels of privilege and agency. But what about at the pinnacle, at the institution itself? Has the pandemic, I don't know, delegitimized the Palestinian Authority? Has it re-legitimized the Palestinian Authority, or broadly construed? So what has been the effect on the sustenance of the state itself?
I mean, in many ways, I think the Palestinian Authority is wildly unpopular as an institution, especially in the occupied West Bank, where it's led by Fatah. Talking about what a state is and does, what has been evident in the last year in especially the Fatah, the Mahmoud Abbas-led Palestinian Authority in the West Bank, is sort of the very core of what a state is and does, which is violence, right? As the dead German scholars have told us, state has monopoly over violence in a territory. Charles Tilley told us that war makes states and states make war. Of course, later Charles Tilley has told us that he also defines the state as a mafia, as a gangster, right? Because the state tends to have the bigger guns, and on the basis of the guns, it makes you do what it wants to do. That's sort of the basic currency of how the state operates, right? So in some ways, especially in the occupied West Bank, that reality of the Palestinian Authority that has worked towards, through this pandemic, primarily to suppress opposition activism after the recent death of Zabanat in the Palestinian Authority prison. So through the pandemic, not just because of the pandemic, the Palestinian Authority has been in an all-time low, if you want to call it a state-like authority. I mean, they're not really recognized as a state-like authority primarily because they don't have the sovereignty, right? For a state to be legitimate is to have a sovereign authority over territory, which the Palestinian Authority does not have. Within the Gaza Strip, of course, it's a different political faction that is leading or running the institutions of the Palestinian Authority. And it's in times of crisis, I don't think there has been any significant change in how they're viewed among Palestinians. I think most of the blame has been placed on the siege or the occupation. The resources, of course, of the state authorities have been quietly famished because a lot of it has had to be repurposed for public health purposes, right? And there's a wide range of goods and services that the state is meant to provide that is not able to provide. And so, of course, that adds the additional institutional challenge to a state or a state-like authority that is already massively weakened. That makes sense.
Well, thank you so much for engaging with these questions. Thank you all for posing your questions.